I think that what was always said, what I always heard from Richard Peto and many others, is that there will be a bit of a lag. If everybody stops smoking, there's going to be a lag before you see the, lung cancer, the cardiovascular disease, etc., come down. That's because all of the people, all of the people that currently smoke, and many who have smoked for many, many decades, it's not that there won't be any benefit for them. I mean, many people who vape here know, they smoke for a long time and they've quit, they've switched to vaping, and they do experience improvements in health. But in terms of those figures, there will be a lag. But, we're talking about at least 10 years now. The benefits are that for New Zealand, less people are even starting to smoke. So that's what Richard Peto said. The earlier you start, the longer you smoke, the more you smoke, the greater the risk. Less people in New Zealand are even starting to smoke. That's number one. Two, they're stopping earlier. So we have many people who are stopping before they get to 30. They're not smoking as long, and they're not smoking as much. So vaping, even if people smoke and vape for a while, while they're transitioning, they cut down on their consumption. So we should be starting to see some effects coming through in the stats, I would say, in the next 10 years, definitely. I also think that there's a well-being, an improved well-being. All of the people who smoked in New Zealand were stigmatised, were made fools of, were ridiculed in mass media campaigns, and their self-worth, their feeling, their well-being has improved a lot, especially if they've switched to vaping. And many others, there's still some people who are sceptical, but there are many people, as my own research has shown, who are having a go. Unfortunately, the misinformation, the negative lies about nicotine are unfortunately putting a lot of people off, but that's something we're all dealing with as a challenge.